हेलो एंड वेलकम टू द न्यू टॉपिक इंट्रोडक्शन टू स्पीच एंड लैंग्वेज डिसऑर्डर। तो अभी तक तो हम नॉर्मल बिहेवियर सीख रहे थे, राइट। वी वर स्टडिंग ओनली व्हाट इज़ नॉर्मल स्पीच, व्हाट इज़ लैंग्वेज, अंडरस्टैंडिंग दिस टर्म्स। नाउ वी विल अंडरस्टैंड व्हाट इज़ नॉट नॉर्मल। ओके, नॉर्मल क्या नहीं होता है, व्हाट इज़ द डिसऑर्डर। So in one of the topics we have already discussed with what is the disease, disorder, disability, all these terms. So यहाँ पे there are two parts of this topic. One is introduction to speech disorders and another is language disorders. ठीक है, so इसमें हम सीखेंगे what is the basic difference between both of them and what is the differentiating factors and what are some of the examples. Very easy topic, very simple topic. So first disorder, what is this disorder? So in speech we have difficulty in producing the sound. So this is all about the production of the sound. Okay, it can also be in voice or a fluency. Now what is production of the sound? Suppose the child wants to say rabbit, child को rabbit बोलना है लेकिन he says rabbit. So instead of r he is replacing with the w. So this is more of a production of the sound production has a challenge. Okay, what is voice? Now suppose somebody is having any kind of vocal cord problem, then his voice might become hoarse. My name is Anand. Okay, or if a male is speaking in a female tone, my name is Anand, in a high pitched tone, right? So these are voice related issues. At the same time, fluency. So fluency is again related to the flow of the speech. If there is any interruption, अगर बात करना continuous नहीं हो रहा है, so if I say my name is, right, so the flow of speech is not there, then it is also called as stuttering. We will see that also. So anything related to speech output comes under the speech disorder. Okay, second thing is the language. One second. I have can't change the color of this pen. Okay, so second comes the language. So in language, this is about difficulty understanding. Either the patient is not understanding itself what you are saying. Okay, it can be because of any reason. So suppose if you ask chai peeni hai, you want to have a tea, he says he's not able to hear, the clarity is not there. That also becomes a language challenge. If you ask do you want to have a tea, and if the brain interprets something else, say do you want coffee, so he says no, I don't want coffee, so it is interpreting something else. So this is about understanding of the language. Second is using the language. Person wants to say I am hungry, but because of any problem the language he uses is something different. So he wants to say I am hungry, he says something else. So in aphasia we see these language expression challenges are there. So they struggle with the grammatic structures, and this type of disorders happens right from infancy, childhood till the old age because of various reasons. So what is the difference? Again, what we have discussed, we will go little more into the depth. So speech and language, this is about the physical act of producing the speech. It's a physical output, right? This is not about how much he has understood or what is he able to use in a societal or a pragmatic context. It's not about that. It's about how much is the expression, how is the speech output. So it is obviously related to the articulation, the pronunciation of the words, about also the voice, how is the sound quality, is it appropriate as per the age, as per the situation, and how is the fluency of the speech, is it continuous बात कर रहे हैं or if there is interruptions. So for example, as I say, stuttering will come. Then also another will come, misarticulation. Misarticulation is mispronunciation of the word. Also voice में अगर हम we will go, then there are different voice issues. We will say vocal nodules. Okay, vocal nodule will create, it's nodule. Okay, it creates hoarseness. So vocal node is a cause, hoarseness is a symptom, or a hoarseness is a disorder. Then fluency, as we say, is stuttering, stammering. Okay, in language, what is it? Language is all about system of communication using words and rules. So here the problem will be syntax. Syntax is, we have studied already in depth about what is syntax, semantic, pragmatics. This is about the structure of the sentence, right? So I want tea, if that is a sentence, and if he uses tea want I, then it's a syntactic error. Okay, semantic is the meaningfulness. Okay, meaningfulness means whatever as per the conversational context. If he is not using the meaningful reply, suppose I am saying, where do you stay, and he says it is 10 o'clock. Alright, so it's not a meaningful reply. Pragmatics. So pragmatic depends, is the social context, what kind of context we are in right now. If I am talking one-to-one, then what kind of communication style should be there. If because of any reason patient is not able to follow the pragmatics, or say, let's say in children, one of the most basic pragmatic thing is giving a social smile or giving a handshake. Or if you say what's your name, he is replying with his name, right? So if the pragmatic issue is there, then you will find that the children does not respond to your to you as per the required situation. Okay, so anything, any interruption in any of this dimension will result in the pragmatic issue. So aphasia is nothing but the loss of language, of asia. So it is loss of language. Mostly it happens in adults, typically, for example, after the stroke, right? So there is a loss of language. So this is one of the examples. Also in this you will also find AST. Okay, also find that the children with hearing impairment have a problem. Also children with mental retardation. So all these conditions can also lead to the language problem. Okay, so again, if we go more into the depth, और इसमें अगर हम बात करेंगे स्पीच डिसऑर्डर में, तो मेनली इसमें 4 टाइप्स हैं. सो वन, इसमें से हमने ऑलरेडी सर स्टडी किया है. दिस इज आर्टिकुलेशन डिसऑर्डर. देयर आर 4 टाइप्स. वन इज आर्टिकुलेशन. दिस इज रिलेटेड टू द साउंड प्रोडक्शन एरर. ओके, सो द बिकॉज ऑफ एनी रीजन इट कैन बी दैट द क्लेफ्ट पैलेट है, और एनी काइंड ऑफ oral deformity, okay, or any kind of hearing disorders. The child is not able to pronounce the sound. So instead of sun, he says thun. Okay, so for sound, that airflow has to go, the proper airflow has to go. That is not happening. So for he says th. Okay, so this is a clear articulation problem. Similar to this, but not exactly same, what happens is the pattern of sound error beyond expected age, right? So what happens is the child is able to speak the sound, but the patterns are wrong. So for example, for the word cluster, हिंदी में हम बोलते हैं जोड़ाक्षरी, right? It's a combination of the sounds. It's a combination of the different type of sound. But as per age, if he is not able to speak, then for cluster he says only cut, something like that. So it is more of a phonological error. It is similar to articulation, but not exactly the same. Okay, so in phonological, the main thing is actually there's a problem in the patterns of the sound, and it goes beyond the expected age. Third, we already studied about the fluency, interruption in sound flow. So it is mom. So this will result in the stuttering. And the voice, the problem in the pitch, pitch is about the frequency. So this is men generally speak at a low frequency, women speak at a high frequency. So if my voice, this is my gender appropriate voice. So if I speak like this, then it is not a gender appropriate. So there is a problem in my pitch, right? Then loudness. Loudness. So as per the context, we speak at a certain volume, right? If I speak like this, which you cannot identify, which you cannot hear. So if it is very small, it is very low, then also it's a loudness problem. Also with respect to the quality I said, so for my voice there is certain quality. If there is too much of some air in the voice, then the sounds will not be clear. If it is lot of hoarseness, or is there any lot of harshness in the sound also, it will sound not normal. Okay, so this will also differentiate different than the normal. So any kind of hoarseness, too much breathiness in the sound, too much air going, or harshness is there, this is more of a quality of the sound. So as I said, vocal hoarseness from vocal nodule we will study in detail. So basically, as you know, this is vocal folds like this, and there is a nodule on it. So because of that, this closure of the vocal fold doesn't happen properly, and then there is a voice disorder. Okay, no need to right now just by heart these things. We will study in detail afterwards. So this is about the speech. Now language. What are those dimensions about the language disorder? In language, there are mainly three types. One is the reception. Okay, found the change of this, correct. Okay, receptive means what? Receiving, right? आपको कितना समझ में आ रहा है. Okay, so if one person, if we instruct the person, pick up red book and sit. Okay, there are two instructions. He has to pick up the red book and then sit. So can he follow the instructions? Is he getting confused, or is he following in the wrong manner? First he's sitting and then picking up the red book, right? So is there any kind of disruptions with respect to understanding of the language? तो हम उसको बोलेंगे receptive language disorder. Okay, so in language again we have to go into the depth and understand is it what kind of language disorder is this. Another is again expressive. Okay, expressive, now it comes about expressing himself, expressing through the speech. So difficulty expressing the thought. So instead of him go park, he says, so instead of he went to park, he says him go park. Okay, so still the precision of this expression is not there. So this is more of expressive. There is one more third one which is not mentioned here, is all about both of combined mixed. Mixed is about the person will have a receptive problem also and also the expression problem. Both are combined. Then becomes a mixed language disorder. Okay, and there is a pragmatic, is about difficulty with social use of language. Okay, so not taking turns or missing sarcasms. So not taking turns is more of, suppose if both of us come face to face, if I am speaking, right, that time you will keep quiet. When you will speak, I'll keep quiet, right? This is more of a turn taking. So only when turn taking happens, there is a smooth flow of communication. If turn taking doesn't happen, if you are speaking, I interrupt you in between. If I am speaking, you are interrupting, then there is no communication happening, right? So turn taking is more of a social use of, correct use of language. Sarcasms, as you know, sarcasm is, though we said it was a pitch dark. So it was completely black. It was so dark that it's pitch dark, but doesn't mean that it was completely dark. There are some sentences which are not taken literally, right? So some individuals take it very very literally. Okay, so that is what is missing sarcasm. So this is about language disorder. Now why these things happen? What are the causes? What makes these things happen? So one is yes, neurological. Neurological is anything related to mostly the brain, though there is another system of spinal cord and other things, but mainly the language originates from the brain. So we're talking about the brain origin. So what is the brain origin? So cerebral palsy. Cerebral palsy is the condition where the mostly the children get this condition. So because it is congenital. Congenital means since birth this happens. So what happens is they have problem in coordination of the muscles. It can be hand muscles, can be leg muscles, or similarly it can be oral structures also. So it is at the nerve level which are going to supply to the all muscles of the body. They have the challenge. Okay, so because of that they have difficulty in not only speaking but also walking, also grabbing things with the hand, also the precision of the movement, also swallowing, because there is no control over the oral structures. Okay, so lot of restrictions happen, again depending upon which part of the body is affected, to what extent. Then there are different types of cerebral palsy, we will study in detail. Then comes the stroke. Stroke is actually nothing but uh, the blood supply to the brain is interrupted. So दिमाग को भी blood supply की ज़रूरत होती है, ठीक है. So because of anything, if अगर जो दिमाग में जो blood जा रहा है वो उसका जो flow है वो बंद हो रहा है, then it can result in a condition called as stroke. तो क्योंकि आपको पता है कि 20% ऑफ द बॉडीज ऑक्सीजन इज़ रिक्वायर्ड एट द ब्रेन लेवल. सो अगर उसको ऑक्सीजन नहीं मिलता है, ब्लड में नहीं मिलता है, तो देयर इज एट्रोफी फॉर सम टाइम. सो ब्रेन गेट्स एट्रोफिक, मीन्स जो हम बोलते हैं उसको कि अकुंचन हो जाता है उसका. तो उसी की वजह से भी डिपेंडिंग अगर उसमें ऐसा एरिया को अफेक्ट हुआ है जहाँ पे विच इज़ रिस्पॉन्सिबल फॉर द स्पीच प्रोडक्शन, ठीक है, then it will have a problem in the speech issue. So depending upon which part of the brain is affected, you will see similar symptoms. Also the brain injury. So brain injury is more of if the person has had an accident which is affected some part of the brain, then also the problem happens. The person is not able to speak or understand the language. Also, what can be the structural challenge? Structural is cleft palate. Cleft is nothing but you see this palate, right? We have a soft palate and a hard palate, and there is a division of between the palate, that's called as a cleft palate. Then vocal cord issue, as we discussed on this vocal fold, if there is a nodule or any other deformity, okay, then it is called as vocal cord issues. That also will have a problem in the voice, and then we call it as a speech problem. Sometimes genetics also happens. Because of genetics, if parents are carrying a certain gene, it may not get expressed in them, but it might get expressed in the children. So in Down syndrome, Fragile X syndrome are some of the syndromes which affects the child's, which are responsible for child's language challenges. In developmental problem, there is autism and intellectual disability, and hearing loss, because the person not able to hear. Then also the clarity of the speech will not be there. And environment can be lack of stimulation, means what happens if the child is not exposed to speaking enough language. These days you see children are more into mobile phones. So because of that also they don't get the proper speech and language stimulation. That also causes the problem. So regarding this all other disorders, okay, we will be going into the depth. Okay, right now we should know the basic, what is autism, intellectual disabilities. No need to study in detail as of now. This is right now just an introduction to all the disorders. Okay, now how to, are there any factors which will tell us upfront, okay, the child might have a problem in future? ऐसे कोई चीज़ें हैं जो हम ऑब्जर्व कर सकते हैं, जिसकी वजह से हमें पता चलेगा कि फ्यूचर में इसको बच्चे को तकलीफ हो सकता है. So one in infants, so what happens is if babbling, what is babbling? Babbling is nothing but the child saying ba 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 ba. So this behavior is called as a babbling. Okay, every one of us has done this. By the age of 6 to 8 months the child starts doing these things. So if there is no babbling till the age of 12 months, then we can say okay, it's a risk factor. Okay, we should do for the detailed testing. If by at least actually by 12 months the child should have first word, but if we say no first word till the age of 18 months, then again this is also one of the warning signs. Limited gestures, limited speech, anything you feel अरे 2 साल का बच्चा इतना बात करना चाहिए जो ये बात नहीं कर रहा है, 1.5 साल के बच्चे में ये जेस्चर्स होने चाहिए वो नहीं हो रहे, दैट ऑल्सो आर द वार्निंग साइंस. प्री स्कूल में है बिफोर द एज ऑफ 3 सेंटेंस आ जाना चाहिए. ओके, एटलीस्ट 2 to 3 वर्ड्स का सेंटेंस. मम्मा पानी दो, दिस इज अ 3 word सेंटेंस. बाबा कम, so these are 2 word sentence. Like this 2 to 3 word sentences should be there before the age of 3. So and also whenever he is speaking, it is difficult to interpret. The clarity of speech is not there because of any reason, and he can't follow the simple instruction, go to the kitchen and get me the plate. If he is not able to follow the instructions, then yes, this is also one of the warning signs. In school age, if it's a poor vocabulary means what? It's a set of words. So every child has a vocabulary, right? So before till he goes to school, they say by 6 years of age, we should by 5 or 6, he should be able to tell the small stories, maybe 4 to 5 sentence stories, right? So for that he should have enough vocabulary, he should have his own set of words. So if it is less than what you see in normal language age children, then again it's a warning sign. Reading and writing difficulties. So in school age, what happens if there is a child is having any challenge? If he is reading a text and whatever text is there, he is not reading as appropriately. वहाँ पे it is written pan and he is reading as dan. Okay, in children with learning disabilities, learning challenges, that is one of the challenges they have, reading problem. At the same time, writing also difficulty happens. So if you see Tare Zameen Par, right, I think his name was Darshil something. I think real name was Darshil. I don't know what is his name from the character. So instead of P, he will read as B or D, right? So writing difficulties also happen. So they have problem in calculation, mathematics, understanding the distance. Okay, so they also have a trouble with the story sequence. एक जंगल में राजा गया, उसने वहाँ पे एक हिरण को मारा और फिर वापस उसको राज पैलेस में लेके आया, राइट? इट्स दैट्स अ सीक्वेंस. दे में से पहले उसको मारा, फिर राजा गया एंड देन पैलेस. सो द स्टोरी ऑफ सीक्वेंस, द सीक्वेंस ऑफ दिस स्टोरी माइट गेट jumbled. That is also one of the warning signs. In adults, if there is slurred speech, right? If what happens during the stroke, typically if somebody is having a stroke, then or say paralysis is there, so half of the side generally starts having slurred speech or it starts drooling down, right? So that is also one of the warning signs. Word finding difficulty means he is thinking of some word. इसको क्या कहते हैं? What do we call this? Which is used for writing, which is pointy, something like that. They will describe the whole thing, but they can't get the word. Okay, that is also a word finding difficulty. And the voice and fluency changes. What we saw is harshness in the voice, and also the stuttering that comes. So these are the warning signs of with respect to age. How it affects life, someone's life, as you can imagine if somebody is having the problem. किसी को अगर प्रॉब्लम है तो क्या क्या हो सकता है? एकेडमिक प्रॉब्लम आ सकते हैं, poor reading writing की वजह से, then he will have challenge in the school. Even if he is capable, he is smart, he may not be able to score properly, right? Comprehension issue academics में फिर समझ में नहीं आएगा क्या सिखा रहे हैं, so his grades will come down. So in future also any kind of job opportunities, business opportunity, that child will miss. Socially it becomes very difficult to make friends because of the language challenge issue. If the person is not able to understand, then definitely he won't be able to make friends. Also trouble in group settings. If he goes into group and there's a pragmatic challenges, he is not able to understand how to do the social use of language, and that will also affect the social uh, uh, life. Emotionally it feels very frustrating, isn't it? if you can't express yourself, और आपको समझ में नहीं आ रहा कि आगे का क्या बात कर रहा है, then it is such a big frustration. And the thing is, it is happening within you, then becomes more frustrating, right? So, and you cannot change it. Okay, let's take a medicine and change it, even it's not that easy also. So that is even adding the frustration. And again, the and emotionally what happens is, that person who is suffering also sees that other person is knowing, is understanding my suffering. Okay, that also feels shame somewhere. Oh, I am suffering for this basic skill of communication. So, and also that's the reason that the person develops the low self-esteem. Occupationally differently, what happens is, because of the poor speech communication challenges and also the poor academics, this will also affect here. Then occupational opportunities will be very limited. Hmm? So for us, what will be our role? So we have to first assess. Assessment, it means analysis, analyze this, diagnose this, and then evaluate speech and language comprehensively. We understand ki if it is a speech issue, then what is a speech issue? Is it a voice issue? It's an articulation issue, or it's a fluency issue? If it's a language issue, is it expressive language, mixed language, receptive language, or is it pragmatic challenge? What should be treatment? Every person is different. हर एक का अलग अलग ट्रीटमेंट प्लान होगा. इट हैज़ टू बी इंडिविजुअल ट्रीटमेंट प्लान डिपेंडिंग अपॉन द what context is affected, also what kind of his social life is, existing social life, what is the requirement, what is the needs, everything will affect. So it has to be treatment plan, and then we have to deliver therapy across hospital depending upon the setup. अगर बच्चा है, it is going like we used to give in different school, like we used to be attached with the children with hearing loss, so we are giving therapy in the hearing impaired children. Then there was one school who was especially having children with cerebral palsy, right? There was another school, there were just 5 children with autism, right? So these are the depending upon the school conditions, hospitals, or if it's a private clinic. And yes, if it is a child, then the most important thing you will keep hearing this word from now onwards is this word called as early intervention. Early means as soon as possible, as early as possible. Intervention means you start your therapy, whatever you can help, as early as possible. सो जितना जल्दी आप हेल्प कर पाओगे उतना ज़्यादा इफ़ेक्टिव होगा और उतना ज़्यादा आसान भी होगा. So it is, suppose there are 2 children, one is 3-year old having hearing loss and speech problem and language problem, another is 5-year old having hearing loss, speech language and language problem. Now when you start giving therapy, it is easy to show results in a 3-year old kid, and you will see results for a longer time as compared to the 5-year old kid. Okay, even if their hearing is same, their current speech and milestones are same. So earlier you will help, easier it becomes. Sorry for that. So earlier you will help, easier it becomes. Okay. So transforming life through care. So common and treatable disorders affect many, but respond well to intervention. Early intervention, as I said, it's a key to successful outcome and life transformation. Okay. So this the whole speech and language career is definitely it's all about giving therapy But the most important term what every therapist should have is more of a empathetic care. Okay, empathy and sympathy are these two different words. Sympathy is all about, oh, so bad it happened with you, I'm feeling so sorry about it. This is called sympathy, right? I have sympathy for you. Empathy is more of, I understand, I can feel what is it. Okay, but instead of feeling bad, you see what is the best you can do, right? Because that is much more important, and that is much more valuable for that person. So empathetic care is about, first is understanding, and then expressive, and then it's more of a powerful healing. So your journey as an audiologist and speech language pathology start with the understanding. Okay, so understanding of the right disorder is important. At the same time, you have become very, have empathetic approach towards all the disorders. I think that's it. Okay, so it's a very simple topic. So in this, there are a lot of disorders names which have come. We will study in detail afterwards what are the each disorders. This is right now just a fair introduction of, a simple introduction about what is it and what is not, about what is speech and language disorder and basics of it. We will go into the depth afterwards. Okay, wish you the best. See you in the next lesson.